Hello, everyone, and welcome. And thank you for tuning in to Health Leaders, the place for peer sourced and solution focused insights for healthcare executives. My name is G. Hatfield, and I'm the CNO editor for Health Leaders. Today, we are speaking with Jennifer Hubek, who is the System Director for the National Nurse Residency Program at CommonSpirit Health, about their new nurse residency program. So, hi, Jennifer, how are you?
Hi, I'm fine. Thank you for having me on the program today.
Of course. Yeah. Thank you for taking the time. I'm really excited to get into this discussion. There's been a lot of, discourse and dialogue about the importance of transition to practice and residency programs across the nursing industry, especially this year. So, right out of the gate, what is the value of a nurse residency program in a new grad nurse's transition to practice into the workforce?
That's a great question. I think it's an important one. The value is that the new graduate nurses, they just need additional support. They need additional training before they're ready to take care of patients. Our patients are so acute.
Mhm.
There are so many health problems that they come into the hospital with, and we want to provide that training and support so that the
Mhm.
new grads are ready and successful as they transition to practice.
Absolutely, yeah, and I think there's a lot of data about new to practice nurses and
Mhm.
turnover and how quickly they're leaving. So this
Yeah.
is more important than ever. So tell me a little bit about the residency program. What's the main goal?
Sure. Well, we have several goals.
Hmm.
Certainly, retention is one of them because we want to keep our nurses. We want them to stay with CommonSpirit Health for their entire career because we have many opportunities within CommonSpirit Health. But as I mentioned, our other goal is to help them transition successfully to practice. We want them
Hmm.
to be competent and safe nurses and happy in what they're doing.
Hmm. Absolutely. And so, what are they learning in the program? What skills are being prioritized in the curriculum?
Well, we actually have several curriculum tracks. So almost
Hmm.
every inpatient track we have, and the skills are different for each one,
Hmm.
but we do prioritize what is specific for that area. So a nurse that's going to the emergency department is going to learn different skills than the nurse in the med surg department. Some will overlap, but there will be some differences based on the clinical track. We also work with them on interpersonal skills such as communication, um, professional development type things like ethics and vulnerable populations. That's part of our program also.
Hmm. Absolutely. And just to refresh my memory, how long has the program been in effect so far?
2.5 years. We started in
Awesome.
February of 2023 with our first
Mhm.
cohorts. Yes.
Absolutely, and are they liking it so far?
They are. We get good feedback from the nurses in the program, and we've also seen some more rural facilities have a significant increase in the number of applicants for the
Mhm.
program because they've heard about it from their fellow nursing students who graduated and began working with us.
Absolutely, that's great. So for nurses who have already completed the program, what skills or lessons do they feel like they can take with them for the rest of their careers?
The clinical knowledge for the track that they're working in, especially if it's a specialty track.
Mhm.
Nursing school isn't always able to spend a lot of time on a specialty track like labor and delivery.
Mhm.
So they take that clinical knowledge, they take the support of their cohort as they
Mhm.
work through the residency program, and then they take those professional skills that we train them on as well.
Mhm. Absolutely. And do you have any outcomes you'd like to share for the program so far? Maybe like graduation rates or anything like that that's fun?
Sure, I'd be happy to. I'll start with number of facilities. We actually have 69 facilities who have
Wow.
implemented the residency program and 15 others who have adopted the program but have not yet hired a new graduate nurse. So that's 84 for
Mhm.
our system so far. Our end of cohort retention, so the number of nurses that start and graduate from the program is 86%. And
Mhm.
for all our nurses in the program, everyone who started through today, our retention is 91%, our aggregate retention.
Wow. Yeah, that's pretty incredible. What are some of the things that make this program unique? Because there's a lot of, nurse residency programs
Mhm.
in the market right now. So what is special about Common Spirits?
I'll say that our focus on our mission and values is the first importance because we want our nurses to adopt our mission and values, and take them seriously.
Mhm.
The other thing is that as we continue to go live, we have a standardized program, and that might be a difference as well. In a large
Mhm.
system, it can be a challenge to have a standardized program, but we do have standardization, and the only variation that we allow is what is specific to a hospital equipment, hospital workflow, state requirements, those kinds of things, and so that brings efficiency. We also
Mhm.
have the benefit, because we're a large system, of having subject matter experts from across CommonSpirit, from every state that we're in, help us develop the curriculum for the program. So that really brings a breadth and depth of knowledge to the program.
Mhm. Absolutely, and as you're mentioning, because CommonSpirit is such a large system, what was it like getting the buy-in from the rest of the C-suite for an approach like this? Because I imagine it was quite the undertaking.
Yes, it was, but we
Mhm.
know that residency programs are what new graduates need to be successful. So I would say, because we had different programs within CommonSpirit, some facilities didn't have programs. The ones that were in CommonSpirit differed in what they were able to provide and the length of the program. They saw the value of standardization and being able to provide this program for every facility that hires new graduate nurses. So that really
Mhm.
brought the buy-in, knowing that we're going to retain these nurses, and again, that they will adopt our mission and values, and really be part of our health system for a long time.
Absolutely, yeah, it's great to try to keep it in the family, you know? Absolutely. So, do you have any advice for other CNOs who might want to try a similar approach at their own health systems?
Well, I will say again, standardization is
Mhm.
key for efficiency, and then we do work closely with the local facilities, because we want to hear what challenges they have and help them work through those challenges. So while we have
Mhm.
a standardized program, there are things that we can do to help individual facilities and be successful with implementing the standardized program.
Mhm. Absolutely. Well, thank you so much, Jennifer, for your time. I'm really grateful to have had this opportunity to get to know you and hear about the nurse residency program at Common Spirit. And thank you so much to our audience for listening. Thank you, Jennifer.
Thank you. It was my pleasure.